Hey, Mr. Jones, my name is Lauren Stewart, and I'm the one who's going to be assessing you today. I see we're doing a normal saline wet to dry dressing change on your hip every 4 hours. I'm also going to check our hospital policy real quick. All right, 2 ways to identify your patient is by their name as well as their medical record ID number, which is on their tag. Also, we need to check for his allergies, and he's allergic to penicillin. So if that was to come up anytime that we would need to use something like that in this visit, we'd have to come up with an alternative, to try and reduce him having an allergic reaction or anything like that here. So now I'm going to give my patient some privacy and close the curtains so that I can go and perform my hand hygiene wash. All right, I'm going to start my water and get it to warm. I'm also going to check my hands for any kind of abrasion, cuts, or anything like that could cause contamination to me or harm the patient. And I'm going to wet my hands. 3 points of soap. And get really lathered up. I'm cleaning under my nails. More water. 2 reasons why we wash with soap and water is to prevent the contamination of C. diff, which is Clostridium difficile. It can cause contamination between nurse and patient and patient and patient. We also use it when our hands are visibly soiled. We can use an antibacterial solution to clean our hands when our hands are not visibly soiled, and also to reduce the amount of microorganisms on the surface of our skin and our hands, okay? So now I'm going to move my phone over here so that we can see me performing on Mr. Jones, and I'm going to perform hand hygiene. All right, so for me to perform this, I'm going to lower the rails on my patient's bed and get him into a comfortable position so that I may perform this. And I'm also going to don my sterile gloves and my glasses. All right, I'm going to start by taking the AB packet or the AB packing on top off, the tape. I'm discarding it. I'm going to take my top gauze off, and I'm also going to take the rest of the gauze out of it to try not to touch the inside of the wound so that there is no contamination. When I get to this point, I'm going to assess the color of the wound, the smell coming off the wound, any kind of drainage that was left in the gauze. I'm also going to palpate the sides of it to check for tenderness, redness, any kind of edema or edema that has formed on the outside of the wound at this point. So now that I've done this, I'm going to take my gauze off with glove to glove, then skin to glove, and discard them in the trash can beside me. And I'm also going to perform hand hygiene just to be safe. At this point, I'm going to start performing my wet to dry dressing. So this is my tools for it. I'm opening it up, and I'm going to place my sterile field. And then I'm going to dump the contents of the basin out on it. There we go. At this point, I'm going to check my saline for the expiration date and palming it from the label. I'm going to open it cap up, facing up, and dump some of the solution into the basin. There we go, and closing it back. At this point too, I'm also going to don my sterile gloves. So here we go. Trying not to contaminate them. Discarding any extra material. So here's my AB packaging for the top of it. At this point, I'm going to start soaking my gauze for the procedure. So in the procedure, we would start with the suture line, since it is the cleanest part of this. So as you can see in my suture line, when assessing it, I would see that it is dry, clean, and the edges are approximated. So I'm going to take one of my gauze, getting the excess solution off of it, and wiping it. All right. I would then take a dry gauze and wipe it. It's important to assess these things because you would have to report it at the end when you go back to the nurse's station. So when I go back, I would document that it was dry, clean, and that the edges are approximated, and there's no observable complications such as an edema or erythema. And then the reason I clean it first is because it's the least contaminated. Also, when you're trying to get your gauze, make sure that you're not touching the basin. So the outside of the basin, in which I am doing contamination because I didn't realize that you could not see it. So in a normal procedure, you would never touch the basin because it would cause contamination during your procedure. So at this point, I'm going to start taking my gauze and getting off the excess and start putting them in my wound. Making sure when you place them in there that you are not contaminating or touching the wound to cause contamination, and that you're also not getting solution all over the patient to cause it uncomfortable. There we go. There we go. At this point, I would take my dry dressing or a dry gauze and I would place it over the top. And then I would take my AB dressing, which is right here, and I would place it over the top, taping it down with some tape. Taping the edges and double taping, making sure that it would not come off. The healing process of this is very important. When I would go back, I also would assess the way the wound looked, if there was any kind of formed edema or erythema in the wound, the drainage of the wound when I removed the gauze before, the smell of it, the tenderness to touch on the patient, if the patient complained of pain or anything like that. Also, while doing this, it would also help me check the tenderness of the skin, if he was having tenderness around the wound area. Or any kind of discomfort, if there was any kind of smell that came off of the wound. All right, so now that it is taped and it is ready, I will now take and discard of all my contents that are in here in the basin, discard of it. And I also would take my gloves off, glove to glove, and then skin to glove. And I would also perform hand hygiene just to make sure that I'm not getting any kind of diseases on my hand or any kind of bacteria that could become harmful. After doing this and assessing the patient, I would walk back to the nurse's station and report the size of the wound, the drainage, that there was no complications like an edema, the color of the wound, the smell of the wound, anything like that that could be important to assessing the wound and making sure that it's all good. And there's no cause of infection. I would also report how the patient reacted to the procedure, if there was any kind of pain. Of course, when I was taking the dry wounds out at first, or dry bandages out at first, if any kind of pain medicine had not been given to the patient, he would have experienced some kind of discomfort. But during the wet to dry dressing change that I had performed with the wet gauze, there should have been no kind of discomfort or anything like that. And just make sure to irrigate the wound to make sure that it's clean, that it can heal properly also. And then I would put back up my sides of my bed and then make the patient comfortable in a position that would be comfortable for him. All right.